Hi, my name is Roberto Portohel, and I'm going to read the chapter 13 of the book Professional English in Use of Medicine. The teacher is Sabina Morla, section 32, subject English Technical Sal 2. Okay, this is the book, and let's go. The oversized doctor. For A, type of registration. To manage and try practicing in the UK, all doctors must register with the General Medical Council. G and C. There are several types of registration. Provisional registration is for doctors who have just qualified for medical school in the UK or from certain European Economic Area (EEA) member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of the training CCT. The GP register is a register of all those eligible to work in general practice in the NHS, not for full details of the General Medical Council. See www.gnc/uk.org. Part B, PLAB. Before they can obtain full registration, some category of overseas doctors are required to take the Professional and Linguistic Assessment Board (PLAB) test. PLAB is designed to ensure those who pass can practice safely at the level of an SHO in the first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skill, and attitudes. Part 2 is an audited structured clinical examination, OSCE. It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. Note: for a full description of PLABC, http://www c http://www.gmc.uk.org/doctor/lab or PLAB/. Firstly, PLAB stations and advice. Okay. OSCES assess this skill. Clinical examination. Your ability to carry out a physical examination of simulate patients and actual training to play this role will be assessed. Uncomfortable or intimate examination will be carried out using a mannequin and an anatomical model. Practical skills. You will be assessed on a practical skills such as suturing and giving intravenous injections. Communications skills. Your ability to interact with simulated persons, or in some cases, the examiner will be assessed. Skill tests may include breaking bad news and giving advice honestly. Story taking. Your ability to take an accurate story and make a reasonable diagnosis will be assessed. Advice on the station from a successful candidate. Read the instructions outside each station carefully. You have 1 minute for this. Don't forget the A, B, and C are always wearing circulation protocols in every emergency station. Keep in the midst softly precautions like throwing the sharp in the sharp bin. Check in the patient understands what is happening, then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the doctor says. Note. Shafts are metal blades, which must be disposed of safely in a special container called a short bin. Exercise 13.1. What kind of registration may these dogs obtain? Look at A of posters to tell you. Number 1. A usually qualified Spanish doctor is provisional registration. A usually qualified Nigerian doctor is a limited registration. The number 2. A doctor who has successfully completed the first foundation year FY1 is a full registration. The number 4, an SHO who has successfully completed the foundation programs and gained a certificate of completion of the training after several specialist registered post specialist registrations. Sorry, a specialist registration. Exercise 13.2. Read the abbreviations in words. Look at A, B, and C oppositories to help you. Number 1. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Number 2. Some overseas doctor must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. Part number 3. Part 2 of the test consists of the OSCE, Objective and Structured Clinical Examination. Number 4. In any emergency, remember the ABC protocols. Airways breathing circulations. Number 5. Before you can obtain a special registration, you must have a CCT, Certificate of Complete Completion of Training. Exercise 13.3. Complete the next. Look at A, B, and C opposite to help you. My name is Musa and I come from Germany. I came to the UK about 2 years August after graduating. Because Germany is outside the EEA, I could only obtain limited registration with the GNC at first. It was very difficult for me to obtain a place of foundation programs. Although I speak a good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling stations, you shouldn't simple memorize a set of phrases. It's better to really think about what you're saying on the actor and get the intonation right. After completing my year clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in many shopping, especially pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EER. Sorry. a candidate from the EEA. Once if completed my second foundation years, I should obtain a CCCT, which will allow me to process to completion of training with the GNC, an important step on the road to becoming a pediatric consultant. Thank you and goodbye.